Hey everyone. ChatGPT AI can answer your questions, but it can't notice your tears, your body language, or the pain behind your words. That's why AI can support mental health, but it can't replace therapy. Artificial intelligence is everywhere right now. People are using it to write emails, plan vacations, create meal plans, and increasingly to talk about their mental health. I've had clients tell me that they use AI to process emotions, ask for relationship advice, and even work through trauma. So the question becomes, can AI replace therapy? As a registered psychotherapist, my answer is simple. AI can be a useful tool, but it should never replace a qualified mental health professional. And today, I want to explain why. So let's start with why AI is so appealing. Well, it is available 24/7. It's free or a low cost. It's instant, it's non-judgmental, and private and anonymous. So if you're lying awake at 2 a.m. feeling anxious, it can be comforting to type out your thoughts and get an immediate response. And in a world where many people face wait lists and cost barriers and stigma, it makes sense that people are looking for alternatives. A 2026 article from the Canadian Mental Health Association noted that people are turning to AI for mental health support, while experts continue to raise concerns about safety, ethics, and privacy. Some early studies are promising. In 2025, researchers at Dartmouth College tested an AI mental health chatbot and found reductions in symptoms of anxiety and depression in a controlled study. That's encouraging, of course. But there's a huge difference between AI used as a structured support tool in a research setting and people relying on general purpose chatbots for therapy. A 2025 study from Stanford Human-Centered AI found that therapy chatbots sometimes displayed stigma and missed important mental health cues. That's a serious concern. That could literally be life or death. Several investigations have shown troubling examples. A psychiatrist who tested popular therapy chatbots while posing as a distressed teen found that some bots encouraged harmful behavior, failed to recognize suicidal intent, claimed to be licensed therapists, and suggested avoiding real treatment altogether. And in one Stanford example, when a user implied suicidal intent by asking about bridge heights, some chatbots simply answered the question instead of recognizing the risk. That is the danger. AI does not truly understand context. It predicts words. And when someone is vulnerable, that distinction matters. Therapy is much more than giving advice. As a registered psychotherapist, I'm paying attention in every session to your tone of voice, your facial expressions, eye contact, body posture, tears you're trying to hide, pauses and hesitations, what you don't say, fidgeting, hand wringing, changes in complexion, rapid eye movement. Sometimes a client says, "I'm fine," but their shoulders are tense, their eyes filled with tears, and their voice shakes. That tells me something important. AI cannot sit with you in that moment and truly perceive your humanity. It doesn't feel, it doesn't intuit, it doesn't build a real therapeutic relationship. Research consistently shows that one of the strongest predictors of successful therapy is the therapeutic alliance, the trusting relationship between client and therapist. It is literally most of the therapy. It is the biggest part of therapy, is that therapeutic relationship. Because that relationship offers safety, validation, accountability, nuance, clinical judgment, genuine human connection. And, as therapists, we integrate your history, trauma patterns, attachment style, relationships, medical concerns, cultural context, strengths, and we adapt it in real time. Therapy is not just information, it's transformation through connection. AI can be particularly problematic for people experiencing suicidal ideations, self-harm urges, psychosis, mania, severe trauma, abusive relationships, domestic violence, and substance use disorders. In these situations, subtle judgment calls mattered. A missed cue or an overly simplistic response can have serious consequences, detrimental consequences. Recent commentary from the National Academy of Medicine emphasizes that AI may have a role, but human relationships and clinical oversight remain essential. Now listen, I am not anti-AI. I'm not going to lie, it scares me, right? But I am not anti-AI. In fact, AI can be useful in mental health for journaling prompts, psychoeducation, practicing coping strategies, generating reflection questions, summarizing notes, supporting therapists behind the scenes. I use AI sometimes as a professional tool, but that's very different from suggesting it should replace therapy altogether. When you work with a regulated psychotherapist, so a registered psychotherapist or anybody who is part of a regulatory body recognized to practice psychotherapy, you're getting formal education and supervised clinical training, ethical standards, confidentiality protections, ongoing professional development, clinical judgment, a relationship with a real human being. And in Ontario, registered psychotherapists are regulated by the College of Registered Psychotherapists of Ontario, the CRPO, which helps ensure accountability and public protection, as do the other regulatory bodies. That level of responsibility simply does not exist with a chatbot. If you use AI occasionally to organize your thoughts, that can be helpful. But if you're struggling emotionally, repeating the same patterns, feeling overwhelmed, processing trauma, or simply wanting deeper self-understanding, there is no substitute for sitting with a trained therapist who can truly see you. AI may be able to generate words, but healing happens in relationships. It happens when another human being notices the tremble in your voice, the tears in your eyes, the story behind the story. That's what therapy is. And that, quite frankly, is something that no algorithm can replicate. If this video has resonated with you, please like, subscribe, and share it with someone who may be wondering whether AI can replace therapy. And I know you're out there because I see it everywhere and I hear it everywhere. All social media, people are using it, talking about it, asking the questions. So remember, technology can support mental health, but human connection is what heals. All right. And with all of that, take care of you.